All right, so I'm on my way to a neurology. Hi, I'm Cliff, and this is Life with MS. I have quite a few tips I'm going to share with you that I've learned along the way that have made this whole experience a lot easier for me, and maybe they'll be useful for other people out there. You probably can tell from the beginning of this video that I had a severe phobia of needles. I mean, I had to have been the worst case scenario for like any clinic. I would literally ran out of a clinic at one point, and I also ran out of a dentist's office at another point. Yeah, so it was bad. And when I learned that I was gonna have to do home injections with Kesimpta because Ocrevus wasn't working, ooh, that got pretty gnarly. And that took me over a year to get my head around that and build up the courage to do it myself. We're going to talk about that in this video, and I'm also going to show you an actual injection and walk you through my process of how I inject, because I think it's important for me to demonstrate my experience. Developing my routine has really helped me deal with the anxieties around taking this type of self-injection medication. And I have a pretty stringent OCD kind of routine, but this is my experience. This is only my experience. I'm not a doctor, I'm not a clinician. Don't take this as medical advice. I just wanted to show you how I deal with things to make it more comfortable on myself and to push past the anxiety that I've had. So let me tell you the story, because this is really relevant to the whole anxiety needle phobia thing. And it's kind of funny now. It wasn't funny at the time. I look back, I'm like, oh my gosh, it's kind of silly. So the year was 2012, 2013, and I had been looking for a diagnosis for my MS for at least 4 years at that point. And I'd been getting all kinds of different diagnoses and people saying, we don't know what's going on with you. You know, the typical story of people with MS. And so I ended up out of desperation and by my wife's recommendation to go see a psychiatrist, because I thought I was going crazy. And the psychiatrist saw me and she said, well, after an hour of evaluating my story and blah, 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 she said, sounds like you have bipolar disorder or some sort of bipolar disorder, because some days you do really well and then the next day you do terrible, and then the day after that you do really well and then the next day you do terrible. And what I mean by really well, I mean I'm perfectly functional, can go to work, do my thing, and then the next day I can't even get out of bed. Does that sound like MS to you? Anyway, we didn't know. So she said, sounds like you're bipolar. Let's put you on some bipolar medication, just give it a shot. And this particular bipolar medication required that I do a blood test and monitor my blood, because I guess it's hard on your kidneys or something. And when she said I had to go get lab tests, I'm sure my face just turned pale white. Like, I hate blood draws, I hate needles, I hate everything to do with that whole situation. But I was gonna man up, at least I thought I was gonna man up and do it. So the day came and I went to go get my blood test. I went to the lab and I sat down in the chair and I put my arm out and my wife was standing next to me. And I saw the technician come around the corner with that tray full of goodies on it, with the sharps on it and all that stuff. And I thought, I can get through this, I can get through this. And the second she just touched my arm, not even to do anything, the tech just touched my arm, I freaked out and got up and ran out of the clinic. And I went to the car and I sat down in the car and I completely broke down. Like, I had anxiety so bad I was like shaking. So I wrote off the whole like bipolar thing because it just didn't seem like the right diagnosis. And after talking to several people and going to some of the groups, I just didn't seem to fit into that category. So I wanted another opinion. But in the meantime, I had a cavity and had to go get the cavity filled. I went to the dentist and he saw the cavity. He says, okay, we're gonna have to drill this one out. And I said, okay. And he came around the corner with that shot. I got up out of that chair with the bib on and everything, and I ran out of the building. And I drove home and I broke down in the car. I thought, what in the heck is going on here? This is not okay. So this would continue on. Ocrevus was the same thing. You know, the IV thing was like, oh my gosh, I'm gonna have to do an IV. I just can't even fathom this. And I eventually got past the IV thing because my doctor gave me a nice healthy cocktail of things that helped me deal with anxiety. And I got through the infusion, though it was not easy. I totally freaked out, but I got through it. And the nurses were great. They were so awesome about this whole situation. So if you watch my other videos, why I switched from Ocrevus to Kesimpta, you'll know that it didn't work out for me because Ocrevus had a lot of crap gap issues for me. And the whole infusion thing was just too much. And so when we decided to go to Kesimpta, it was a very, very new drug. And it was the first time any patient in my particular clinic was going to take it, and they didn't know how it was going to work out. And I said, sure, I'll sign up for it, but I didn't know it was a home injection, and I didn't know it was a once-a-month injection. And I figured that out. I'm sure my doctor told me, but I was just so overwhelmed at the time I didn't listen. And when I figured out that it was going to be a home injection, I made up every excuse in the book not to do it. And I literally waited a year, and my MS started getting pretty bad. I thought, I need to get on this. And I had to dig deep. I think the primary things were like, I was really having issues with walking, memory. I couldn't really drive anymore. And the walls were just getting closer and closer and closer on my life. And it was not fair to my family. And it's like they say, when you have MS, everybody around you has MS. And so I'm only doing my part by doing what I can to handle my MS and doing the best that I can. I finally came to the realization that I really needed to do this. And of course, the stuff my doctor was going to give me to reduce anxiety, it was going to help. But that only helped so much. I had to dig deep within my body and my mind to think, I'm doing this not for me, I'm doing this for my son, and I'm doing this for my wife, and I'm doing this for my parents, so they don't have to take care of me and push me around in a wheelchair because the MS is progressing so fast. And that was really the motivating thing, was like, don't play into my fears, be brave for them. And that's what got me to sit down and finally do that first injection. But it took a long time to get there. And I'm glad it did, because now it's like brushing my teeth. And it's very simple for me. It's easy. And I've learned a lot about doing the injection. And I'll tell you this, now when I go get my other stuff, like my other blood draws that I have to do regularly, it doesn't really bother me anymore. I can go in and do it. Sometimes I'll take a little something to help with the anxiety that the doctor prescribes, but I don't really freak out about it anymore. It's something I feel like I understand, and that brings a level of comfort to me because I can do it myself. And that's also really cool. It's very empowering to have a phobia that high for that long in your life, and you conquer it, and you're like, oh, this is awesome. And I feel like I really have a leg up on the MS. Like, it no longer controls my whole me through my anxiety. So I am a worst case scenario for this anxiety thing with MS and needles. If I can do it, I think anybody can, but they have to find their process. What I want to do now is switch over to a video, and I'm going to show you my process of how I actually take the medication and some things I've learned along the way that make it a lot easier. And I hope you enjoy it. And here's a fair warning that there is a scene in here where I actually inject. You really can't see anything because the needle's covered by the actual device. But if that kind of stuff makes you squeamish, heads up, it's in this video. Overall, it's a 5-second injection. It's very easy. It looks like I'm giving myself a stamp, really. It's not a big deal. Please comment below if you found something in the process that makes this easier for you, because when we share, we win. Thank you. So first of all, I keep it in the fridge, and I make sure I keep a thermometer in here because, well, I'm a little bit OCD like that, and I like to have control over every element that I can, since the rest of it is not really anything within my control. Next, I take it out of the fridge, open it up, and this one's critical for me. I always check the expiration date and the lot number on it to make sure it's still good. Now, I, in the past, have received one that didn't have an expiration date on it, and I didn't catch it until after I injected it. So that was a big no-no, and I made the manufacturer aware of this issue. So I always double check to make sure it's got all the information it needs, which is a lot number and an expiration date. And also, I'm not going to show you the outside of the box, but it has my prescription information on it, and I double check to make sure it is my name, my address, and it also has the expiration information on it. Now what I do is I let it sit out for 35 minutes and get up to room temperature, because there is a big difference between injecting it when it's just out of the refrigerator and injecting it when it's room temperature. The colder it is, the more it's uncomfortable. I guess that's the best way to describe it. It's not painful, but it's more noticeable. Now you can see I've had plenty of opportunities to experiment on where to inject, where is most comfortable for me. And of course, this is only my experience. I'm not a doctor, I'm not a clinician, I'm just a bald dude on YouTube with MS, and this is a process that works for me.
So the first thing I do is I wash my hands really, really well. And I usually do this when I get right out of the shower, but for this demonstration purpose, I'm going to do here. And I use the alcohol swabs and I go around a big spot here. And here's a tip. I don't have a lot of flab around the midsection, and I tried injecting in my midsection standing up before, and it's not very comfortable. So I've come up with a little kind of saying that helps me remember how to do it every time. I'm just going to do this. A little more alcohol here. And this probably is not unique to me, but this is how I remember it. Grab, flab, and jab. I'm going to sit down after I open the injector. This is a really quick process, by the way. And what I do, and this makes a huge difference, is after I've rubbed the place down with an alcohol swab, I wait 30 seconds for the alcohol to evaporate. If I inject when the alcohol is still wet, it burns. I let it dry off by fanning it off a little bit. I'm going to sit down. I'm going to grab that flab, and I'm more than 2 inches from my belly button, like it says to be. And what I do is I have that nice little flab there. I kind of go in at an angle. And this is really simple. 1, 2, 3, 4, 5. And it clicked for a second time, and it's done. And then, because I have an Austin Powers hairy stomach, I use one of these tiny little Band-Aids, because if I use a big Band-Aid, it actually hurts a lot more to take the Band-Aid off than it does to take the injection. And the injection, because I do it in the flab like this, it's not very uncomfortable at all, and it's really fast. So that's my process. I've done it in the leg before, the first time. That was not good for me. I know other people have had other experiences. It was not very comfortable. This is tried and true for me. It's simply my process, and it works really well. And when I'm done, I'm going to take the cap, and I stick it right back on there like that. And I put it in my sharps container. But when I fill this bad boy up, I send it off to be disposed of. And for this needle phobe, I can't believe I can do it myself. That's the best part. So I hope you can take something away from this. Maybe it'll help you, maybe it won't. Again, I am not a doctor. I am not a clinician. I am not a professional. I'm a bald dude on YouTube with MS, and this is simply my experience. Thanks for watching.